Are you gasping and wheezing? Do you have asthma or exercise-induced asthma? Then in this video, there's a treatment that you probably haven't heard about that I've seen amazing clinical outcomes. Check it out. I'm really excited to share with you a treatment for asthma that most people haven't heard about. It's a natural, non-prescriptive treatment that we see tremendous outcomes with on how to help retrain your nervous system and your immune system so that it doesn't throw a temper tantrum when it's being faced with the stimuli. So what happens with asthma, and this really works well for exercise-induced asthma and seasonal asthma, some of the more, difficult asthma cases, this might not work for, but I would be willing to try. And so let me tell you about this really, really cool treatment called the infraspinatus respiratory reflex. So that's kind of a mouthful. We call it the IRR treatment in the office. And again, going back to the mechanism of asthma, if you and I went out and walked in a field of ragweed pollen, your system might be totally fine and my immune system might freak out or have a temper tantrum based upon that antigen, and it gets irritated. And so it secretes fluids, your eyes would run, your mouth would run, you get red, your airways might shut off. And the medical treatment for that is let's do an anti-inflammatory, some type of cortisone or steroid therapy, and possibly an antihistamine. Now, you can do that, and I think it's great for short-term relief, but a long-term correction, you can have some unwanted side effects from the steroids and from the antihistamine therapy, which causes a whole nother set of problems. So a couple different ways that you can retrain the nervous system. One, you can help the immune system to work better so that it doesn't overreact. There's a specific technique called desensitization therapy. I think homeopathy works really well. There's a Japanese herb called yakatron that I've seen really good outcomes with, milk thistle, and then there's a Native American herb called lomatia. And I see really, really good outcomes with lomatia, and that's more on the biochemistry standpoint. From the biomechanical standpoint, there's a really neat technique, again, called the infraspinatus respiratory reflex. I want to give credit where credit's due. It was developed by Dr. Harold Philibert down in Louisiana. And he discovered a technique where actually it's a nerve reset. And I don't know if he called it that, but that's what I would categorize his research. What happens is there's a nerve that comes out of the neck called the cervical C5 nerve. It goes to a muscle called the infraspinatus muscle, which is underneath the spine of the scapula. So right over here, you'll feel that hard bone, but underneath that, there is a muscle called the infraspinatus muscle. And he figured out that if you were palpate or press upon that muscle, it can be really, really sore in people that have asthma. And so what he did is he took a solution, a needle, and he started injecting those sore spots. And what happened is the lung or the bronchial tissue, it basically opened up. And we think what happened is there's actually a nerve reset that comes from that muscle that goes basically up the nerve into the spinal cord, up to the brain, resets this reflex, and opens the lung tissue. Now, this treatment's really easy to do. You have people lay on their stomach, put the arms to their side, and you just palpate that muscle. And most of the time, people don't even realize how sore that muscle is until you start specifically pushing on it and palpating it. Then you can take a solution. In our office, our medical team will usually use a combination of vitamin B12, methylcobalamin, some para-aminobenzoic acid that's a glycolized ester. So it's in a medicine called Procaine. A homeopathic that we usually use ubiquinone, which helps to unclog detox pathways, and sometimes just a little titch of vitamin C. You take a little needle and you basically palpate with a needle, and you can get these trigger points to basically relax. So the muscle fibers, they're supposed to slide on each other like this. They actually tighten, and you hit those with a needle and they'll start to free up. And what happens is people can start to breathe, and you can see this in our video testimonials of people that have come in with chronic asthmatic problems, and in a treatment, well, it usually takes about 2 to 4 treatments. We reset that nerve impulse and they can breathe substantially better. If you add the nutrition component to that, the homosensitization therapy, I think there's really good options to help alleviate, or at least decrease your asthma symptoms. It seems to work really, really well for exercise-induced asthma. So this is a couple clinical pearls of what you can do for asthma. The other thing I forgot to mention with some cervical manipulative therapy at C5, C6, a chiropractic adjustment, and also you can do some soft tissue release technique on the muscles associated with the neck, the rhomboids, infraspinatus, supraspinatus, and the lats that go through there, and the upper trapezius. Thank you for watching the video on asthma. If you perceive value, please like us and push the little bell so you know when our next video is coming out.